later, the actual implementation of the approach. Training opportunities are really important. Things like this are going on around the country. There are also full-day workshops that are available through the Complete Streets organization, a nonprofit. And so teams of engineers and planners come together and spend a day introducing the concept in a bit more detail than you'll see here. And there's a whole series of educational opportunities on the actual implementation. And then, again, the new performance measures that are created. So that's an important piece to actually get it accomplished, and then the resulting, sort of the result in connection to public health, as Representative Harding mentioned, are some of the things that you can tie together with the improvements and their impacts on public health. There's a lot of really good research out about that. So what's going on in New Hampshire? In Keene, just this summer, an initiative passed. There was a resolution, and that was actually a citizen-driven initiative. A group of young professionals that get together regularly. Keene's a very bike-friendly community, just received its bronze certification as a bike-friendly community, along with Concord. And so that was a natural progression, a natural evolution for Keene to take that step. At UNH, the UNH Institute on Disability is just looking for funding to try to begin the process of education, convening communities to discuss the Complete Streets approach, and their focus naturally is people with disabilities. And so their focus is going to try to tie in service to that population, but they will also be incorporating, their work will incorporate every facet of the community as well. And then Concord adopted a policy in 2010. So it's happening in New Hampshire on a small scale at this point. This is a good example of some of the other things that are going on around the country. North Carolina recently, in 2009, adopted a policy, very comprehensive, very well written. Commissioner Clement has it in a package, also available online. But the basic components of it, you can see this great graphic which gives you an idea of what it's about. So it's simply including all of the modes of travel. So you have the cars, you have the bicycles, you have the sidewalk. But the idea is that travelers need to be able to choose where to go, and that's the idea behind Complete Streets, is giving everybody a choice. So if I would rather bicycle, it would be really great to have the infrastructure to allow that. And sometimes it's as simple as painting a stripe on the road. There doesn't need to be a lot of expense involved in developing a Complete Streets approach. Alternative forms of transportation, more sustainable communities, community connectivity, and safety. Those are the major components of the North Carolina approach. And one of the other hats that I wear is I work for Greenplay LLC, which is a master planning and design firm, as a part-time consultant doing trails and pathway projects. And that, what we're learning around the country is a lot of communities, when you do the community engagement piece, what comes to the top is community connectivity through non-motorized connections. So there is a movement around the country in the planning process when it's citizen-driven to allow for those connections, allow for those social engagements, support public health movements in the community. Some other state examples, near and far. Connecticut has a policy that also has this quick fix approach. So it's very low cost, easy fixes that are to demonstrate the commitment to including all the travelers in the transportation system. New York, this is a multi-level advocacy approach just passed this summer. Unfortunately, it was inspired by the death of a child on a busy roadway. So the Complete Streets policy had been attempted a few years ago but did not pass. And then with the death of his child, the parent got motivated and gathered everybody together and said, we need to change this. This is really important. We need our streets to be safe for everyone. Vermont just passed legislation this past summer, and I think the only other city in Vermont, Burlington, I believe, is a bronze level bicycle-friendly community. So New Hampshire now has 2. Vermont has 1, so that's a movement that's taking hold up there. The belong to Oregon and Florida, and if you're familiar with Portland, Oregon's bicycle-friendly status and their initiatives, that's taken about 20 years to achieve that status, with a lot of work and a lot of collaboration with the transportation system, both nonprofits and business and in the private sector and government. And so currently, roughly 25 states have policies or legislation, and that's growing and changing every day. And then in Massachusetts and Rhode Island, they've also enacted legislation. So who wants complete streets? Well, there's lots of great data in the health community about my generation, the baby boomers, wanting to spend more money now, and we have more disposable income, we want to have more free time. We're very concerned about our health. We believe that walking and exercise is an important part of our routine. So older Americans really want to have this kind of an application in their communities. And I do a lot of bicycling on rail trails in the Northeast, and whenever I travel, I try to get onto a rail trail or bike trail in the community that I'm traveling in. And what I really love to see is senior citizens passing me on the bike path with their racquetball rackets or their tennis rackets or their rollerblades in some cases, heading off to the local tennis court from their home without having to get into their car. And so health promotion benefits of this approach are really far-reaching and have a great impact. So again, the seniors, the children, people with disabilities, those are the folks that are seeking this kind of treatment to the roadways and transportation systems. And then the built environment, you're familiar with that term, I'm sure, that simply, the infrastructure, it makes a difference. Changing the built environment does make a difference in public health. People also want to get out of traffic, so more people choose, in surveys, more people want to improve public transportation than have more roads built. So that's information that we know. Why are they important? So as I said, mode choice. If you want to be able to choose to get on your bike or in your car, that should be available to you. It includes all travelers, not just people that are in cars. Addresses social inequities. So we know that people that are in the poorer socioeconomic levels often don't have cars. They often have trouble getting to public transit or may not be available to them. So getting work is difficult because of those issues. So Complete Streets helps to mitigate that. So it exposes the community and it includes all populations and sort of balances that social inequity that we see around the country. And of course supports public health initiatives. I've made it work too hard already. Oh, okay, that's great, thank you. So Complete Streets policies are also consistent with federal highway administration guidance. So I know there are updates happening now. There's new language probably that exists, but Commissioner LaHood, Commissioner of Transportation, has a lot of wonderful books. Is very supportive of the whole livable communities, sustainable communities movement. So it's definitely in keeping with the philosophy and thinking of the Federal Highway Administration. So what's wrong with an incomplete street? Well, they're unsafe. Very high numbers of people interacting with cars on busy roadways when they try to cross the street without a sidewalk. It's very, very dangerous. So they're just unsafe. And then, obviously, there are lots of examples in our state around some of the rural areas in New Hampshire where roadways may have just a dirt shoulder or no striping at all, no sidewalks, no safe crossings. I'm working right now with Bill in Canaan, trying to work with the town of Canaan and develop a safer crossing between a neighborhood and a school along busy Route 4. So that's an example of some of the improvements that can be made, that should be made to allow safe crossings and mitigate some of the dangerous crossing issues that we have. And then, how telling is this? Incomplete streets are definitely inaccessible to people in wheelchairs. So simple things like curb cuts can make a world of difference for someone getting around their community in a wheelchair. So again, just to summarize, the built environment can definitely have impact on the environment by reducing car use, public health, by increasing people's choice to be physically active, and definitely the economy. I'll get to that a little bit later. So what are some of the transportation planning trends that we see? These slides are a combination of complete streets slides, some slides that I use in presentations that I make on building healthy communities. And the Federal Highway Administration has a wonderful university series